In the past week alone, 1 million Canadians have returned to Canada from abroad, and the Prime Minister has a strong message for them.
If you've just returned from abroad, go straight home from the airport and do not leave for at least 14 days. This is not a suggestion.
Work is underway to repatriate other Canadians who are still stuck abroad. And as Ross Lord reports, in this time of crisis, rescuing everyone right away is proving to be impossible.
Among the throngs of tourists in Peru desperate to return home, there are thousands of Canadians, like this group of high school students from Vancouver College. They came to help build a home for a single mother. Then the COVID-19 outbreak escalated, forcing the government of Peru to close its borders and force everyone into quarantine.
There is a lot of underlying stress, especially when they phone home. You can see that they're just trying to hold it together.
Lillian Vernier is managing her own stress, a medical problem that requires an intravenous procedure every 2 months to keep the condition at bay.
After 2 weeks that I've missed my injection, then my condition will become more problematic. And that 2 weeks comes up on Friday.
Friday is when the last of 3 scheduled Air Canada flights from Peru to Canada is due to leave. Passengers receive a code in advance.
So as soon as we get a code, we need to book our ticket, pay for our ticket, and then hopefully we make it before everybody else.
It's becoming a competition.
We're checking our emails every 5 minutes.
Diego Martinez, his wife Gabriela, and their daughter Margot are torn. They urgently want to return to Toronto rather than risk being infected and at the mercy of Peru's overwhelmed healthcare system. But they're distraught about leaving their hosts, Gabriela's parents.
I don't think my dad, who's suffering of Alzheimer's, would make it. And
if he gets infected.
God forbid. But yeah, that's a scary thought. If I have to leave, if I'm called into one of those remaining 2 flights.
The Canadian Embassy says it's working to secure more flights as the emotional effects of the crisis deepen. Ross Lord, Global News.
India has taken extreme measures to avert catastrophe. The entire country, 1.3 billion people, have been ordered to stay home for 21 days. Prime Minister Narendra Modi says as of midnight, everyone should forget what going out means, though he says essential things like food and medicine will be available. There are only about 500 confirmed cases in India, but testing has been limited and a spike is expected. And this is Britain under lockdown. Everyone in the country under strict orders to stay home except to get food and do limited exercise. Gatherings of more than 2 people are banned and only essential workers are allowed out. The lockdown is set to be in place for 3 weeks. That's up for review, though. Britain recorded its highest single death toll today, 87 new deaths. It's now clear the U.S. could soon be the next epicenter of this global crisis. The spread of the virus is accelerating there frighteningly fast. There were more than 9,000 new cases confirmed just today. That's the biggest increase of any country. Yet President Donald Trump says he wants to get everyone back to work by April 12th. At least one top public health official says that could lead to millions of deaths. Jackson Prosco reports.
From the sprawling convention center that will soon become a 1,000-bed hospital, New York's governor issued a dire warning.
The rate of cases, the rate of new infections, is doubling about every 3 days.
Medical equipment is already in short supply. A quarter of those hospitalized are in intensive care. Now there are predictions of a tidal wave of cases over the next 3 weeks that will overwhelm the system.
We're not slowing it, and it is accelerating on its own.
But in Washington, President Donald Trump urged a speedy return to normal life.
You're going to lose more people by putting a country into a massive recession or depression. You're going to lose people.
Just halfway through his own 2-week campaign to slow the spread, Trump now suggests social distancing and business closures aren't worth the economic toll.
I'd love to have it open by Easter.
I think at this time, this is a little bit too early.
Experts have warned lifting restrictions too soon would be disastrous.
If you let it run rampant, at least parts of the health system could
get overwhelmed.
That's already the reality in New York,
And we're not going to put a dollar figure on human life.
where the state has just a fraction of the 30,000 ventilators and 140,000 hospital beds it needs, and where officials are now begging the federal government to order production to meet expected demand. Jackson Prosco, Global News, Washington.
We know you have lots of questions about this virus. Our Jeff Semple will continue to consult with experts and try to answer them. Email your questions at globalnews.ca, and our website also has a special page dedicated entirely to COVID-19. You can visit globalnews.ca/coronavirus.